Hey, it's Jessica DaMassa with WTF Health. I am here at Webit, and joining me right now, I have Mark Davies. He is the Chief Medical Officer for IBM Watson. Hi.
Hello.
So how are things going at IBM Watson? What's new over there?
So it's great. So it's a really exciting time for us. IBM has a long history of addressing some of the big challenges in the world, and healthcare is right up there at the top of some of the difficult challenges that we need to address. So,
and there's been some challenges addressing the challenges, right? So where are you guys at? Because I mean, this is harder than I think we all thought, right? And so what's going on? What are you guys working on?
Yeah, I'm not sure it's true to say that it's harder than people thought. People knew it was going to be challenging. Healthcare is complex, it's adaptive, and it's always a difficult area to do work in. But the approach we're taking in IBM Watson is we're leading with science. We're making it very clear that we're building the evidence base around what we're doing. We're concentrating on publishing the data and the evidence for the work that we're doing. And in many ways, we're treating the work that we're doing no different from any other kind of clinical intervention you might introduce into healthcare. You build the evidence, you build a story, and then you take with you professional and consequently public confidence. That's where we're at. It's early days. This is 3 years in. Yeah. As you can see, it's not all been easy. But we're starting to see really significant results, and we're starting to see people waking up and actually realizing the potential of this technology.
How are things going with clinicians? Like, I mean, in your role as CMO, I mean, I'm sure you're talking to the doctors, and I mean, at least in the U.S., I can't speak for in the U.K. or in Europe, but in the U.S., I mean, there's always this, the data, and people start to then, of course, link back to the trauma of EMR. Yeah. And so how are things going with the clinicians and kind of changing, I guess, the mindset to pivot and kind of embrace this more optimistic outlook as far as data and what's possible there, knowing the problems that are in existence around it?
Yeah, so I guess we're at a point of inflection. So if you spoke to most clinicians, by and large, they tend to be human beings as well. Yeah. So what they experience is a world of what they see from their consumer world as individuals, of using their Spotify or their kind of online shopping or whatever, which is by and large a really positive experience. A lot of it focused around artificial intelligence and using advanced analytics, and they see the benefit of that, right, both in terms of their home lives, their personal lives, and with their family. But at the same time, when they go to work, they seem to go back 3 generations, yeah, 3 decades. And suddenly they're in a world which doesn't seem to have kind of realized the opportunities. So I think there's a degree of anticipation, but there's also genuine frustration, professional frustration. They can see what it could do, but universally we're not there yet. There are pockets of success, and there are stories starting to emerge about how the world could be different, but it's not, as they say, universally distributed.
Why is healthcare so slow to integrate this in? Do we really need to go this painstakingly slow? Like, I mean, I'm all for making sure that things are, clinically valid and that there's regulatory in place, because you can see from some of the startups, especially recently, some of the Silicon Valley startups that have gotten in trouble for not doing their due diligence or whatever. But, I mean, do we have to move this slow?
So that's a fantastic question. And healthcare, I happen to believe is important. I happen to believe that it's more important than online shopping or musical streaming.
One would think.
One would think. So I am strongly of the view that healthcare cannot be the last industry to take advantage of artificial intelligence and this kind of emergent technology. So yes, we need to go faster. We are one of the most highly regulated industries in the world, and with good reason, right, because when we get things wrong, life or death. It's life or death. And therefore that regulation and that framework that we operate in and the professional ethics and standards that we operate in are really important. But we could be going much, much faster than we are at the moment. Some of the challenges and some of the things that have held us down is, yes, clinical engagement can be a challenge. The experience that clinicians have had of technology has not been universally positive, and they've often had
a little bit of a grudge being held.
I think some of that is fair.
Yeah, I agree.
I'm
not judging the grudge. I'm merely reporting that it's there.
And that's fine. But let me tell you, I spent 25 years as a primary care physician in the UK. So we have been paperless in primary care for the last 20 years. And those EPR systems, which they are, grew up out of very small businesses within the fabric of those practices. And do you know what? Those GPs, they never grumble about their technology. It's an intrinsic part of how they do business.
Right.
And today they are benefiting from contextually relevant decision support. They're getting information prompts around allergies, around recommended treatments. They have absolute faith in the kind of disease registers, the recall, the booking systems they've got. It's an intrinsic part of how they practice their profession in the same way as their stethoscope is. So it's not true to say that we can't do this.
Right.
So we absolutely can. We need to embrace modern ways of designing systems. We need to embrace user-centered design principles. We need to think about modern ways of user experience. We need to think about how we introduce technology into the workflow in a way that just doesn't digitalize what we currently do and impose digital on an antiquated way of working, but actually we start to think about new models of care, new methods of delivery, harnessing digital capability. And that's happening, but as you say, it's happening a bit slow.
It is happening slowly. And I'm wondering, I know that you weigh in terms of like at a macro level on policy quite a bit. Sure. And so I'm curious because people will always say, especially when you frame that problem up like that, where it is more systemic, everybody starts to then talk about policy and incentives. Yeah. And so from your opinion, I mean, is there something that could be, I guess, smooth the way and make things move a little bit faster from a policy or an incentive standpoint that you're seeing?
So I think the secret sauce of this, the answer to this.
Tell us the secret sauce.
The secret sauce is system alignments.
Okay, what does that mean to you?
So for me, this is around taking a whole system approach to how we address the big challenges in healthcare and thinking about, financial flows, but also the regulatory system, thinking about how we plan workforce and how we deploy workforce throughout the system and how we start to shift the balance from a focus on organizations and professionals towards a focus on populations and patients. So it's that level of aligning the money, the regulation, the workforce, and the accountability along with the objectives that we want to see. Now, you do that in a way that allows you to capitalize on the opportunities of digital, and you can go much faster. And you know what? There are parts of the world where that is starting to happen, whether they're called integrated care systems, whether accountable care systems, but whole system alignment around a responsibility for a population is the way to kind of break through some of this.
You make it sound so easy, Mark. Thank you so much for taking the time to talk with us. It's a pleasure to speak with you as well. I'm Jessica DaMassa with WTF Health here at Webit in Sofia, Bulgaria. Thanks for joining us.